In Borderline, the Biography of a Personality Disorder, psychologist Alexander Kriss offers an in-depth exploration of borderline personality disorder, BPD, intertwining historical analysis with a detailed case study to challenge prevailing misconceptions about the condition. Kriss begins by recounting his experience with a patient named Anna, whose diagnosis of BPD defied the common belief that individuals with this disorder are untreatable. Through their therapeutic journey, he illustrates the complexities and potential for recovery inherent in BPD treatment. The narrative delves into the historical evolution of BPD, tracing its roots back to antiquity when behaviors now associated with the disorder were labeled as possession, hysteria, or witchcraft, terms often used to marginalize women exhibiting emotional instability. Kriss highlights how these archaic interpretations have influenced modern perceptions, contributing to the stigma surrounding BPD. He emphasizes that such historical biases have led to the marginalization of those diagnosed with the disorder, particularly women. Kriss examines the pivotal role BPD has played in the development of psychotherapy and modern psychiatry. He discusses how early encounters with patients exhibiting borderline symptoms prompted the medical community to refine diagnostic criteria and therapeutic approaches. This historical context underscores the significance of BPD in shaping mental health practices and challenges the notion that the disorder is a modern construct. Throughout the book, Kriss critiques the conventional wisdom that deems BPD patients as manipulative or resistant to treatment. By sharing Anna's story, he demonstrates that with appropriate therapeutic interventions, individuals with BPD can achieve meaningful progress. This perspective advocates for a more compassionate and individualized approach to treatment, moving away from generalized and often negative stereotypes. The author also explores various therapeutic modalities, including dialectical behavior therapy, DBT, developed specifically to address the unique challenges of BPD. Kriss provides insights into how these therapies can be tailored to meet the needs of each patient, emphasizing the importance of flexibility and empathy in clinical practice. He argues that understanding the individual experiences of those with BPD is crucial for effective treatment. Kriss addresses the societal implications of BPD, suggesting that the disorder reflects broader cultural anxieties and systemic inequalities. He posits that the emotional volatility and identity disturbances characteristic of BPD may be, in part, responses to societal pressures and fragmented cultural narratives. This viewpoint encourages readers to consider the interplay between individual pathology and collective social dynamics. In his analysis, Kriss emphasizes the importance of viewing BPD through a lens that recognizes the humanity and individuality of those affected. He challenges the reductionist tendencies in psychiatric diagnoses, advocating for a more nuanced understanding that considers personal history and context. This approach aims to destigmatize the disorder and promote more effective, person-centered care. The book also delves into the gendered aspects of BPD diagnosis and treatment. Kriss discusses how historical and cultural biases have disproportionately pathologized women's emotional expressions, leading to misdiagnosis and inadequate treatment. By highlighting these disparities, he calls for a re-evaluation of diagnostic criteria and therapeutic practices to ensure they are equitable and inclusive. Kriss's narrative is interspersed with reflections on his own professional development and the challenges mental health practitioners face when working with BPD patients. He candidly shares his initial apprehensions and how his experiences with patients like Anna have reshaped his understanding of the disorder. This introspective element adds depth to the discourse, illustrating the reciprocal growth that occurs in the therapeutic relationship. In conclusion, Borderline, the Biography of a Personality Disorder, offers a comprehensive and empathetic examination of BPD. Through historical analysis, case studies, and personal reflection, Alexander Kriss challenges entrenched stigmas and advocates for a more compassionate and individualized approach to understanding and treating the disorder. His work serves as a call to action for both the mental health community and society at large to re-evaluate their perceptions and treatment of those living with BPD.